Hello and welcome to your Harrisburg Area Community College Blended Learning EMR program. James Weber here. Going to do a little bit of work on bleeding, shock, and soft tissue injuries. First things first, damage to internal soft tissues and organs can cause some pretty life-threatening conditions, right? Some internal bleeding can result in shock. Shock is a state of collapse of the cardiovascular system that results in inadequate blood or delivery of blood to the organs. More trauma patients die from shock than any other condition, and we're going to leave you a bunch of additional content within that chapter or this chapter on shock. The concept of standard precautions assumes that all bodily fluids are potentially infectious, which is the reason why we've got to take some appropriate measures to make sure we protect ourselves from this blood that we've got to stop coming out of our patients. Wear gloves wherever you can, and if it's appropriate, get a little bit more involved in that. Do things like wear surgical masks as well as eye protection. So let's get to the core of it, right? Controlling external blood loss is one of the biggest challenges we have and it's vitally important that when our patients are bleeding, especially life-threatening bleeding, right, we get on it pretty quickly. So there's different types of bleeding. Capillary bleeding, venous bleeding. Capillary bleeding is the most common type. It's that slow ooze that comes out of a patient. That type of capillary bleeding is pretty easily fixed by just simply applying some direct pressure to the site. Venous bleeding is a little different. It's the second most common type. It's got a steady flow generally, and it's something you're going to need some additional direct pressure on, right? So more often than not, you'll need it for at least about 5 minutes or so to get that steadier flow venous bleeding to no longer bleed. Arterial bleeding, that's the most serious type of bleeding, right? Arterial blood spurts or surges with each heartbeat. It is real hard to stop. Sometimes, actually more often than not, this tends to be a surgical case, which is all the more reason why it's important that you try to get as much direct pressure on it as possible until EMS arrives. It's really going to make a huge impact on a patient if we really focus on making sure that we get as much direct pressure on that patient as possible to reduce the amount of blood flow. Direct pressure. When I say direct pressure, I mean something as simple as get a dry, sterile dressing, put it on the wound, and press on that wound hard as you can with a gloved hand. Wrap that dressing and wound snugly with a roller gauze or bandage. It's going to make a difference, right? And do not remove the dressing after you actually apply it. You gotta leave it there, right? Leave it there. If it bleeds through that dressing, we'll have to add to it. But for the most part, when you're doing direct pressure, you put it on, you wrap it, and you leave it there to continue to hold that in place and make sure that it's covered, it's not going to get infected, and that bleeding does stop. Elevate, right? If direct pressure does not stop external bleeding from an extremity, you can try to elevate the injured arm or leg as you maintain direct pressure. Tourniquets. Tourniquets are only really indicated when extremity bleeding cannot be controlled by direct pressure or elevation, right? Take a look in your book. There's Skill Drill 14.1 that deals with controlled bleeding with a tourniquet. You will spend a fair bit of time on our skill day to work on things like controlling bleeding with a tourniquet. Pressure points. Pressure points are used in cases where the wound is too close to the trunk to apply a tourniquet, prevent blood from flowing into the limb by compressing the artery against a bone. The brachial artery pressure point and the femoral artery pressure point are the most important pressure points to know because those are the ones in which are going to reduce the largest amount of blood flow should those extremities be affected. Just some examples of femoral and brachial artery points that you can use for those pressure points. Wounds. Wound is an artery or an injury caused by a physical means that leads to damage of a body part, right? Wounds can be a couple of different types. They can be open or closed, right? Closed wounds is where the skin remains intact, and the only closed wound is a bruise, right? You have an injury to the soft tissue under the skin. More often than not, the small blood vessels are broken, which is the reason why you might see some discoloration as well as swelling. Simple bruises heal pretty quick, right? Complicated bruises might take a while. And I tell you, some of the real bad bruises, some of the real bad swelling, it may not look like it's broken, but that bruising and that swelling could be a sign, or at least something that is hiding a remarkably more significant underlying fracture. Open wounds. An open wound results from a break in the skin. Abrasion, also known as a scrape, road rash, or rug burn, it occurs when the skin is rubbed across a rough surface. This is an example of that. And it's just that abrasion that gets developed from the skin getting broken away during that rubbing sensation that we talked about down below here. Puncture, right? Punctures occur when a sharp object penetrates the skin, may cause a deep injury that's not necessarily immediately recognized. Puncture wounds do not bleed freely. An impaled object sticks out of the skin, and a gunshot wound is a special type of puncture wound because as that bullet goes into the body, it creates some pretty extraordinary damage as it makes that entry. Puncture wounds. This is just an example of those open puncture type wounds that will lead those open portals for potential infection, and this is a pretty extraordinary example of it. Laceration, most common type of wound, commonly called a cut. Minor lacerations may require little care. Big lacerations can even be life-threatening and cause extensive bleeding. Just some examples of that. Avulsions and amputations. An avulsion is the tearing away of body tissue. If an entire body part is torn away, the wound is called a traumatic amputation, which is a little bit different than an avulsion. A traumatic amputation would be a circumstance where the body part's actually entirely missing altogether. Big thing, amputated parts should be located. Find the parts. If a person's saying, I can't find the part, assign someone to go find the parts, right? Locate them. Place them in a clean plastic bag. Keep them cool. Don't put them directly on ice. But we want to keep them cool, right? And take to the hospital just in case they could do some semblance of a reattachment. Open wounds. These are just some examples of some open wounds that might qualify under the previous definitions. Some principles of wound treatment, right? Very minor bruises need no treatment. They will go away, right? Other closed wounds should be treated by doing things like applying ice, a gentle compression, and elevating the injured part. Splint all the major contusions. Stop the bleeding as quickly as possible using the cleanest dressing available. Dressings and bandaging are applied to control bleeding, prevent further contamination, immobilize the injured area, and prevent movement of impaled objects. So dressing is an object placed directly on the wound to control the bleeding or prevent decontamination, right? This is the thing that stops the infections from happening by closing of that wound. While a dressing is in place, apply firm manual pressure to stop any bleeding. A couple of different sizes of pads, and those are listed there. Dressings. If the bleeding continues after you've applied a compression dressing, put additional gauze over the original dressing. If you have some bleeding stopped, but it hasn't stopped completely, right? If you go to take that bandage off, all you're going to do is open up the wound you've just closed, right? So it's pretty darn important that we just continue to put additional bandages on top until that bleeding finally stops. We can start to get to the point where the bleeding stopped completely. Bandaging, of course, bandages used to hold dressings in place. Roller gauze and triangle bandages are commonly used in the field. Some principles of bandaging: ensure the patient and the dressing completely covers the wound and extends beyond all sides. Wrap the bandage just tightly enough to control bleeding. Check that circulation regularly and make sure you secure that bandage so it doesn't slip. Because when it slips out of place, it really doesn't have a whole lot of good purpose. Standard precaution techniques: wear gloves, avoid contact. Face and scalp wounds. Small lacerations will produce in the face and scalp a ton of bleeding. Just a ton of bleeding, right? You can control all or almost all facial and scalp bleeding by applying a manual direct pressure. Direct pressure compresses the blood vessels against the skull, and because you have that skull there, right, it generally does a pretty good job with only direct pressure to remove that bleeding. That's just an example of a bandage that started with direct pressure and became a pressure bandage in that right picture. Now, for wounds inside the cheek, hold gauze pass inside the mouth. Always keep that airway open. Hyper-focus on that. Scalp lacerations can be associated with skull fractures or brain injuries. If you have any brain tissue or bone fragments visible, do not apply pressure. Cover the wound loosely. With head injuries, the neck and spine may also be injured. Move the head as little as possible and stabilize the neck. Monitor the patient's airway of breathing and protect the spine. Nosebleeds. Nosebleeds can result from injury, high blood pressure, or dry air. A nosebleed with no apparent cause is called a spontaneous nosebleed. Some methods to management: unless the patient's experiencing shock, have the patient sit down and tilt the head slightly forward. Pinch both nostrils together for at least 5 minutes. If the nosebleed persists or if it's severe, make sure you arrange for transport. When an eye laceration is suspected, cover the entire eye with a dry gauze pad. Have the patient lie on their back and arrange for transport. If a small foreign object is lying on the surface of the eye, you can use some simple saline solution to flush the object from the eye. Now, an impaled object. Immediately place the patient on his or her back and cover both eyes, right? And the thought process is, if you have an impaled object in your right eye, right, both of your eyes move in tandem when they track something within our visual field, right? So if you have something that's impaled in the eye, and this eye is kind of looking at different things around the room, it's going to cause this eye to look at different things around the room, causing this damage to be worse, right? So if you limit what they can see, tell people to just simply look forward, you'll cut down on the amount of movement that occurs within the affected eye itself. And arrange for transport. Neck wounds. Use direct pressure once it's controlled, dress that neck. In rare cases, you may have to exert finger pressure above and below the injury site to prevent neck bleeding. Major trauma can be associated with spinal cord injury, neck fracture, or some pretty significant airway problems. I would really suggest that you maintain the patient's airway and stabilize the head and neck, as we've discussed in the past. Place patient with a chest injury into a comfortable position. If the lungs punctured, air can escape and the lungs will collapse. The patient may cough up bright red blood. Cover the chest wound with an airtight material and administer oxygen quickly. Chest wounds may damage the heart. Seal the wound. Treat the patient, and if the patient's breathing becomes more labored after you seal it, remove the seal briefly and allow some of that air to escape and reseal the wound. Impaled objects. Apply a stabilizing dressing. Arrange for prompt transport. Sometimes those impaled objects, if it's impaled for too long, it may be too long for the patient to be transported. This has actually happened to me. Stabilize the impaled object and carefully cut it close to the patient's body whenever you can. But we want to be able to really limit the amount that goes into whatever transport vehicle you're going to use. If an object is protruding from the abdomen, don't remove it. Support the object so that it can't move. Place gauze or towels on either side of the object and secure them with additional gauze. Closed abdominal wounds. Result of direct pressure from a blunt object. Look for bruises or other marks on the abdomen. Whenever a patient's experiencing shock, I would really suspect internal abdominal injuries. And that can happen. There's a lot of blood and a lot of different organs in that space. Place these patients on their back, elevate their legs, and use blankets to conserve their body heat, because that's one of the later signs of shock that's at least manageable on the level of an emergency medical responder. If a patient's vomiting blood, it may be an indication of bleeding from the esophagus or from the stomach. Monitor the airway, give nothing by mouth, and transport promptly. Open abdominal wounds usually a result of slashing with a knife or another sharp object. If the intestines are protruding, place the patient on his or her back with the knees bent. Cover the injured area with a sterile dressing. Do not attempt to replace the intestines inside the abdomen themselves. This is an example of how that treatment might look. Right? It's like anything else. We just want to simply stop the bleeding, cover it, and then once it's covered and we get that bleeding stopped and we've closed up the potential for infection, call for transport and make sure that person gets to the hospital quickly. Genitalia wounds, male and female genitals have lots and lots of blood, so injury to these areas can be really severe. Apply direct pressure with a dry, sterile dressing, and although it might be embarrassing to the patient, we do have to look, especially if you suspect injuries. But, get it out of your mind that we don't look there. We've got to go look, because if there's significant bleeding, we got to figure out how to get that bleeding stopped. It'll affect the patient in the long run. Extremity wounds, apply a dry, sterile compression dressing and secure it in a place. Elevate the injured part, split the injured extremity. Now, gunshot wounds. Most death from gunshot wounds will result from internal blood loss, right? Gunshot wounds to the trunk and to the neck are a major cause of spinal cord injuries. Treatment. What can we do? Monitor and manage the airway and establish adequate ventilation and circulation. Control external bleeding. Examine the patient. Find all the holes. Treat the patient for shock. Arrange a prompt transport. Perform CPR if the patient's heart stops. Bites. All bites carry a pretty significant risk for infection. Minor bites can be washed with soap or water. Major bite wounds control the bleeding, apply direct pressure, and a bandage. Burns. The skin serves as a barrier that prevents foreign objects from entering the body. It also prevents loss of bodily fluids. When skin is damaged, it can no longer perform those important functions. There are several levels of burn. Of course, superficial burns are the lowest level burns. It's when your skin gets reddened, maybe it's painful. These are your sunburns, right? Injuries confined to the outermost layer of the skin, but does not have long-term damage to the skin. Partial thickness burns, those are second-degree burns. They do not damage the deepest layers of the skin. You will see some blisterings and more often than not, some fluid loss. But these are things that tend to heal relatively quickly within, 3 to 6 weeks, depending on how bad it tends to be. Full thickness burns are third-degree burns. They damage all layers of the skin. It is generally not painful because we've destroyed all the nerve endings in the body. Patients lose large quantities of bodily fluid and tend to be susceptible to shock and infection. More often than not, the burns are not what will kill a patient who's experienced burns this level, but it'll actually be the shock and the actual infection. Rule of nines is just a way to measure those burns. It is a method. You'll see on the learning platform some charts in which I'll actually lay out the rule of nines within this actual chapter. But check out that chart; it'll give you an indication as to the total measurements. And notice that, by the way, that it's a little different for kids versus adults, right? Just for example, 9% of the body for an adult is the head, 12 for a child, 18 for an infant. Why? Because proportionally, infants have a much larger head-to-body ratio than an adult does, which is the reason why it has that increased in the number of, or the percentage number that would be affected should they achieve or should they receive a burn in that space. So it really is just the percentage of the body that's affected when this happens. Cause or type of burns. Thermal burns caused by heat. Place in a burned area in clean, cold water. Cover it with a dry, sterile dressing. Do not break blisters. Patients with large burns should be treated and transported to the hospital. Respiratory burns. Be mindful of this for any person who's been in a house fire. Respiratory burns. A burn to any part of the airway, right? Look for some key points to this. Burns around the face, singed nose hair. When you open up their mouth and there's soot in their mouth and nose, that's an indication of an airway burn. Breathing difficulty, pain while breathing, and loss of consciousness as results of a fire. Respiratory burns. Breathing problems can develop rapidly or slowly. Administer oxygen. Be prepared to perform CPR. Arrange for prompt transport. Chemical burns. Many strong substances can cause chemical burns. Chemical burns, the longer the chemical remains in contact with the skin, the more damage that it does. Get as much of that stuff off as possible. Get a towel and really just kind of brush as much of it away as you can, right? Flush it with water for at least 10 minutes. Cover the area with a dry, sterile dressing and really focus on arranging transport. Chemical burns. Chemical burns to the eyes can be really painful, right? The more water you put on it, the better off you're going to be. Hold the eye open. Cover the injured eye with gauze bandages to reduce some of that swelling and arrange for prompt transport. Electrical burns, of course, are when they occur when electrical current enters the body and exits in a different space. Electricity causes a lot of internal damage. Patients may experience irregularities in the cardiac rhythm as well as full cardiac arrest and death. It's actually not uncommon for patients who have associated electrical burns, depending on the amount of electricity that went through the body during the electrocution. Electrical burns. Be certain that a patient is not still in contact with the electrical power source before you treat them. Call for assistance from the power company and monitor the patient's ABCs and arrange for prompt transport. Real quick, a quick summary. You must take appropriate standard precautions to prevent contact with patient's bodily fluids. 3 parts of the circulatory system are included. 3 causes of shock: pipe failure, pump failure, and fluid loss. Refer to the videos that you'll find on D2L about shock in this chapter. 3 types of external blood loss: capillary, venous, and arterial. And most external bleeding can be controlled by applying direct pressure to the wound. A wound is an injury caused by any physical means lead to damage to a body part. Open wounds are classified as abrasions, punctures, lacerations, and avulsions and amputations. Closed wounds, on the other hand, are bruises. Controlling bleeding. Control bleeding by applying direct pressure, elevating an extremity, or applying the tourniquet or using pressure points. 3 classes of burns are as listed. Pay very close attention as to the types of burns you're going to see in the field. That's kind of a quick rundown of what we kind of worked our way through over the period of the past 25 minutes or so. This is not meant to be an all-inclusive lesson on what goes on within the chapter, but more of a quick review of what you should have caught when you were doing your reading. We appreciate your time, your patience, your energy as you work through this content. Don't get discouraged. We're on the tail end. Should you have any questions, reach out to your program coordinator. And again, we appreciate your time, patience, and energy, and we look forward to hearing from you at our next discussion. Have a great day.